My name is Professor Mohamed Bukar. I work with the University of Maiduguri in Nigeria as a lecturer and with the University of Maiduguri Teaching Hospital as an honorary consultant obstetrician and gynecologist. The title of my lecture is Clinical Application of International Ovarian Tumor Analysis Simple Rules with Case Examples. The learning objectives are to be familiar with the IOTA simple rules and to apply the simple rules in clinical practice. All images for this presentation were of patients managed in 2 hospitals in Maiduguri, the capital of Borno State. Greetings from Maiduguri, the home of Daba. Now let's look at the simple rules. The simple rules have 2 components: the malignant component and the benign component. There are 5 M rules under the malignant tumor and 5 B rules under the benign tumor. M1 under malignant is irregular solid tumor. M2 is presence of ascites. M3 is at least 4 papillary projections. M4 is irregular multilocular solid tumor with largest diameter greater than 100 millimeters. M5 is very strong blood flow, that is color score of 4. For the B rules, B1 is unilocular. B2 is presence of solid components where the largest solid component has the largest diameter less than 7 millimeters. B3 is presence of acoustic shadows. B4 is smooth multilocular tumor with largest diameter less than 100 millimeters. And B5, no blood flow. Rule number 1 is if one or more M features are present, in the absence of B feature, mass is classified as malignant. Rule number 2 is if one or more B features are present, in the absence of M feature, mass is classified as benign. Rule number 3, if both M features and B features are present, or if no B or M features are present, the result is inconclusive. So you have benign, uncertain, and malignant categories. Now let's look at the B rules. B1 is unilateral lesion. B2, presence of solid components where the largest solid component has a diameter less than 7 millimeters. B3 is presence of acoustic shadows. B4 is smooth multilocular tumor with largest diameter less than 100 millimeters. And B5 is no blood flow, that is color score of 1. And the M rules, M1 is irregular solid tumor. M2 presence of ascites. M3 at least 4 papillary projections. M4 irregular multilocular solid tumor with largest diameter greater than 100 millimeters. And M5 very strong blood flow, which is color score of 4. Now let's look at the cases. Case number 1 was a 17-year-old student who had laparotomy in a peripheral center and was referred after symptoms recurred. She presented with progressive abdominal swelling and weight loss. These are the ultrasound scan images. It's an irregular solid tumor, presence of ascites, very strong blood flow. So you have 3 M rules, no B rules. So it is classified as malignant. She underwent surgery and histopathologically confirmed to be yolk sac tumor. Case number 2 was a 65-year-old gram multipara who had surgery a year prior to presentation. She presented with gross abdominal distension and wasting. This was the ultrasound scan image. It was an irregular multilocular solid tumor with largest diameter greater than 100 millimeters. No B features. So this is classified as malignant. She underwent surgery and histopathologically confirmed it to be cyst adenocarcinoma. Case number 3 was a 75-year-old gram multipara who presented with a 3-month history of abdominal swelling. These are the ultrasound images. It is not an irregular solid tumor, no ascites, no papillary projections. It's not a multilocular lesion. There is no strong blood flow. It's not a unilocular lesion. The solid component is more than 7 millimeters. No acoustic shadows. It's not a smooth multilocular lesion, and the blood flow is at least 2. So neither M rule nor B rule apply. So this is inconclusive as far as the simple rules are concerned. But studies have shown that 40% of inconclusive lesions by simple rules turn out to be malignant lesions. So she underwent surgery, and histology confirmed it to be serous adenocarcinoma. Case 4 was a 31-year-old single lady who presented with a 2-year history of abdominal pain and 3 months history of abdominal mass. Her CA125 was 40. These were the transabdominal images, and this was a transvaginal image. We can see that it's an irregular solid tumor with presence of ascites. Let's pay particular attention to this solid lesion on transvaginal ultrasound scan. You can see this is a solid lesion with cysts within the substance of the solid lesion. Here you can see the largest cysts casting H shadows. These H shadows should not be imputed as presence of acoustic shadow. Why? Because this shadowing is not coming from the substance or from the parenchyma of the lesion. It is coming from the edge of the cyst. So, is there acoustic shadow? No, there is no acoustic shadow because this is edge shadowing from a cyst within the solid component of the tumor. Now, if you take acoustic shadow as being present, that means this lesion is inconclusive because there will be both M rules and B rules. But without taking acoustic shadowing, you only have 2 M rules without B rules. And this classifies the tumor as malignant. The patient had surgery, and histopathology confirmed that it was a mucinous papillary cyst adenocarcinoma. Case number 5 was a 20-year-old para-2 visually impaired woman. She presented with pain and abdominal mass. This was an irregular solid tumor. So we have 1 M rule, no B rules. So M is a malignant lesion. She had surgery, and histopathology showed us that this scilla duval bodies, and so it's a yolk sac tumor. Case number 6 was a 50-year-old gram multipara who presented with abdominal swelling of 1 year and abdominal pain of 4 months. By subjective assessments, this is typical Swiss cheese appearance of granular cell tumor, but the only M feature was very strong blood flow, no B features, so it's classified as malignant. She underwent surgery, and histopathology confirmed that it was adult granular cell tumor. Case number 7 was a 60-year-old gram multipara who was 10 years postmenopausal. She presented with a 5-month history of abnormal uterine bleeding. She was a non-diabetic and transfused 4 units due to the heavy postmenopausal bleeding. Again, subjective assessment will suggest that this is adult granular cell tumor, although it's not a typical Swiss cheese appearance. But by the time the endometrium of a 60-year-old is looking like this, in all probability, you are dealing with an estrogen-producing tumor. But there were no M rules and no B rules. So this lesion was inconclusive. She underwent surgery, and histopathology confirmed that it was adult granulosa cell tumor. Case number 8 was a 34-year-old para 3 who presented with a 5-month history of amenorrhea. UPT was positive but became negative a week after laparotomy. Again, subjective assessment, typical switch this pattern, but there were no M rules and no Beerus, so it was inconclusive. She underwent surgery, and the histology showed us that these were called external bodies, so it's a case of adult granulosa cell tumor. Case number 9 was a 43-year-old gram multipara who presented with a 2-year history of recurrent lower abdominal pain and abdominal swelling in a few months. Here, we can see that it's not an irregular tumor, but it's postulated. So this postulation is not considered as irregular. So ascites, yes, there was presence of ascites, presence of acoustic shadow, as we can see here. Very strong color flow, not really, because this color flow is not actually from the tumor here, from the lesion, but from the fimbriae attached to the lesion. So the blood flow is not very strong. So you have both M rule and B rules. So this is inconclusive. She had surgery and it's supposedly confirmed that it was a fibroma. Case number 10 was a 21-year-old grade 2 para 1 at 70 weeks of gestation with right lower quadrant abdominal pain. No M rules, no B rules. So they're inconclusive. But she had surgery. Even at surgery, we confirmed that this was a pedunculated fibroid, and histology confirmed that it was a degenerated uterine fibroid. Case number 11 was a 21-year-old newly gravida who was single and presented with a 3-week history of abdominal swelling and 3 months history of abdominal pain. Here you can see that it was an irregular solid tumor with very strong blood flow. So 2 M rules, no B rules, so it's classified as malignant. She underwent surgery and histology confirmed that this was an immature teratoma. Case number 12 was a 57-year-old multipara who was managed for intestinal obstruction by the surgeon a year prior to presentation. Her CA-125 was 20. Here you can see that it was an irregular multilocular solid tumor with largest diameter more than 100 millimeters with a strong blood flow. So 2 M rules, no B rules, classified as malignant. She underwent surgery and histology confirmed that it was high-grade serous carcinoma with metastasis to the colon. Case number 13 was a 34-year-old multipara with recurrent lower abdominal pain. Only 1 B rule applied, no blood flow. So it was classified as benign. She underwent surgery and histopathology confirmed it was mucinous cystadenoma. Case 14 was a 30-year-old multipara with lower abdominal pain of 8 months duration. Abdominal examination revealed a cystic, mobile, non-tender mass of 24 weeks gestational size. Ultrasound scan revealed that it was a unilagual lesion with no blood flow. So 2 B rules, no M rules, so it's classified as benign. She had surgery and is supposed to confirm it to be mucinous cystadenoma. Case number 15 was a 27-year-old multipara whose last childbirth was 7 months prior to presentation. She presented with abdominal swelling, and examination revealed a mass which was equivalent to 36 weeks gestation. Ultrasound scan revealed a local lesion with no blood flow. So 2 benign lesions, 2 benign rules, no M rules. So it's classified as benign. She underwent surgery and histology confirmed it to be serous cystadenoma. Case 16 was a 30-year-old para 2 who presented with a 5-month history of abdominal swelling, vomiting, epigastric pain, and weight loss. Ultrasound scan revealed that this is an irregular solid tumor with ascites and a very strong blood flow. So 3 M rules, no B rules, classified as malignant. She underwent surgery and histology confirmed it to be cis adenocarcinoma with metastasis to the cervix. Case 17 was a 33-year-old multipara whose last childbirth was 4 months prior to presentation. She presented with abdominal pain and swelling. Ultrasound scan revealed a local lesion with no blood flow. So 2B rules, no M rules. So it will classify it as benign chain down surgery, and histology confirmed it to be serous cystadenoma with the ball as hemorrhage. So our take-home message is that subjective assessment by an expert remains the best in characterizing adenal masses. Knowledge of aorta lexicon is essential. I have covered this in one of my lectures. Aorta simple rules is easy to use. Thank you very much for listening.
Wani ba in yi lai karatu likita ɗan yake yi Allah ya ba shi wannan fita ya ba shi wannan Allah ya ba shi wannan fita ya ba shi wannan hata kuma